With Dr. Nikko. Dr. Nikko is a cosmetic surgeon in Houston, Texas. He's agreed to answer some questions specifically related to male breast reduction. With that said, Dr. Nikko, let's go on to the first question that was posted online. First question was, is it covered by insurance?
Sometimes it's covered by insurance, but the majority of the time, I would say most of the time, is unfortunately is not covered by insurance. We've tried numerous times, and many times it's been rejected.
Understand. Next question was, will this affect the types of chest exercises I'll be able to perform?
No. As a matter of fact, after the surgery, 2 weeks after surgery, you should be able to go back to your normal routine and really guys work out and have the shape they like, and it doesn't affect the type of exercises. It doesn't decrease their ability to lift, and also they should be able to really get the shape they've been wanting to get.
Okay. Will I lose sensation to my nipple?
Yes. Anytime we do surgery that involves liposuction or excision of some type, we're always, going through nerve fibers, and that normally takes some time for it to go back to normal. Sometimes people say it's a little bit more sensitive, but most of the time there's slight numbness, and that normally takes about 6 months to go back to 100%. Sometimes there's slight alteration, maybe a decrease in 10% sensation, but nothing major that any of my patients have complained about.
Okay. Next question was, what will my breast look like after the procedure?
Yeah, I think a lot of people can. Obviously, it varies from one patient to another. It depends. Some people have just a plain gland, and then that's normally just basically a kind of a conical shaped nipple area. But most of my patients that I see, they have not just the glands, but they have the stubborn fat in their armpit, the side of the chest. And so liposuction typically is involved in that area, plus excision of the gland. This is an example of what you can see. This patient here, has that gland that causes that shape. But then, he also has a little fat here on the side of the chest, and then in the armpit area. So when that happens, I always try to scope that area, because it's very hard for guys to get rid of fat in that area. And if you're going to go under surgery to get rid of that gynecomastia, that breast gland, then you might as well do a little lipo to get the shape that you want to do. Because a lot of guys, we like to wear tank tops, and that's the main purpose of working out. And so I encourage them to go ahead and do it at that time. Okay.
Next question was, where is the surgery performed?
Surgery is performed in our outpatient surgery suite. It's it's right there in our facility. They don't have to go to the hospital or anything, and so our wonderful staff, get to take care of them. And more importantly, the cost is reduced, because by not going to the hospital or surgery center, you don't have to pay the expensive cost of the facility. And also doing it at our facility, liposuction takes a lot of time, and sometimes these things take time to do, and we can take our time. We don't have to rush through, and so it's in our facility.
Okay. And what are the risks associated with the procedure?
Most of the risk associated with this procedure is basically related to cosmetic issues. For example, if you didn't remove all the glands, there may be still a little bit left in there that you have to go back and get. Sometimes you take out too much of certain tissue or skin, it may dimple in a little bit. So it's more of cosmetic issues, nothing major medical risk, that happens during surgery. I mean, aside from, your normal infection and hematoma, those are very rare if patients follow instructions. But most of the risks involved are just, minor cosmetic, maybe a little gland left in there. And then that can be taken care of very easily. I mean, it happens, but that stuff happens less than 5% of the time if we're careful with the first procedure.
Okay. And the final question we had was, how long is the recovery period?
Yeah, how long the recovery period is a great question. Now, typically, I tell patients 2 weeks from surgery, they can go back and do all their chest exercises, and there shouldn't be any problem. Time from work really is, if they do normal work, desk work, they can, several days off from work. But again, there's that numbness and swelling and all that. So it does take several months at least for all that to subside and get better. And how long would it take for them to look, have the shape and look that they like? And normally I would say, you want to give it at least 2-3 months at least to see the final results. And then, another common question is guys come to ask, well, does this ever recur? Well, you go in and you take the glands out. It should not recur. You should maintain the results for a long time. Even if you gain a little weight, you may gain weight in other areas, but you should not gain back in this area and the glands doesn't grow unless the patient decides to, if the initial cost was anabolic steroids and they do more steroids, and then of course it may come back. But most of our patients, they kind of, if that was the case, they really don't go back to that. And so recurrence rate is really, very little.
Excellent. Well, if you have any additional questions for Dr. Nikko, all you need to do is post them in the comments section below. Excuse me. He's agreed to answer those questions online for you. With that said, Dr. Nikko, thanks for your time.
Yeah, thank you. And, we'd love to have you come in and let's evaluate, and we'll certainly give you the kind of results you want. And if you have any more questions, please call our staff at 713-960-1311, and we'd love to help you.
Appreciate it.